Leukemia symptoms can be quite vague, and then you can be very sort of feeling extremely tired. So it's a very, anything unusually tired, whatever age you are, you need to be worried about. But most of the tiredness may not be anything sinister, but picking up these sort of things early enough is always the best. And if patients come in very young, fit, and patients come in with, I mean, two patients I can remember from my memory, they used to do half marathons and were so fit, exercise, committed people suddenly become, they can't do what they used to do. And there's sudden change in the exercise tolerance, which is a very important warning sign. And the other thing is any unusual type of bruising or bleeding, like gum bleeding, sore gums, excessive periods in females, suddenly, no, not from the early, I mean, sort of sudden change, and also getting infections after infections, and not clearing infections quickly. Everybody will get infection, but if things are not clearing off in good time, needing antibiotic after antibiotic. So these are not, this should be excluding people on a chronic smoker with a bad chest, but this is a normal people. Suddenly their immune system goes completely in a stray where it can affect these sort of tactile features. But a simple blood test will tell you. So there's no magic. You just need a blood test to pick it up. So it's very easy to diagnose. It's not as complicated like you need a scan or anything to tell. A simple, quick, a full blood count test would give us the diagnosis very quickly anywhere in the country. The leukemia doesn't, it comes from the bone marrow. So it's actually your marrow bone is where you produce all your blood cells. So it's probably spread out everywhere. So you've got marrow cavity in all the long bones, your pelvic bones and skull, everywhere you got. So that is why people may get sort of bone pain, and the blood production happens in there and then it comes into the blood. So the leukemia, early leukemia can be quite misleading. The blood things may take a bit more time. So to pick up early leukemias is always a bit of challenge, but there are lots of signs which we would predict towards that diagnosis. But it's always in the marrow bone, and it is what we call like it's a stem cell disorder, and it can affect any age. So there is no age, even from a newborn baby. You got childhood leukemias, or in 80s or 90s, elderly, middle age, everybody. So it's nobody is free of that condition. So it is, age is not a barrier. There is no peak for age, but it's almost happens in your stem cell. It's a stem cell malignancy, and that is where the problem starts. I mean, the cause of the leukemia is, there's a lot of theories and influences which have been told, but one of the examples we see is places like Chernobyl, wherein now it's actually, I didn't realize it was in Ukraine. Chernobyl is one of the biggest nuclear disasters. And after the Chernobyl, and also following the Hiroshima Nagasaki thing, you've seen a lot of leukemias in that cohort of people around that area. And I personally treated somebody who used to work in Chernobyl, and it is purely by coincidence. And that I'll never forget it. I mean, it's just he used to work in that area. He's a farmer, but he used to be, he's a pig farmer. He used to work in Russia and used to be all over transatlantic, trans-Siberian part. And it's actually there is something there with radiation or some sort of external influence, the way we are living. I mean, a lot of factors could be dealing with it, because this childhood leukemia is connected with high-powered electric power stations. And also there's so many new theories coming out saying your gut microbes can dictate what conditions you will get. So if you got a healthy gut microbiome, like you got bacteria, you can be very healthy. But if you got an unhealthy bacteria, then you get lots of illness and diseases. So same thing with the leukemia. It could be a trigger, but nobody knows. And there is no trials or anything to prove or disprove it. But try to be as healthy as possible and try to be active and do the exercise and things. That should be the most useful tips. I think the leukemias can be very wide spectrum of conditions. On one end, you got a chronic leukemia. Then the other end, you got the acute leukemia. When you come to the acute leukemia, they are very dangerous. They need to be treated there and then. But those acute leukemias, we are curing them. So there are lots of people are cured. They're doing extremely well. So there's the concept of this wrong concept of leukemia and death is not true anymore. We can treat a lot more nowadays with new treatments, and bone marrow transplants are curing many leukemias. It's only the very elderly, frail, we struggle because they're not fit enough for treatment. So that's a group we are really struggling. But there are new treatment options come out where they can be treated with new types of treatments with targeted drugs. So it is an evolving field. So it is a lot of new treatments are very successful. And thanks to COVID to that extent, because we got so many new drugs been approved during that time. And people are doing much better. So they're actually treated at home now because of the COVID, which has opened up a new form of treatment. And the chronic leukemias, they live normal life. There's nothing, they're doing phenomenally good. It's a chronic myeloid leukemia or chronic lymphatic leukemia, they all can be treated. And again, it's by targeted treatment now. Hardly many people use chemotherapy for that group. They're all tyrosine kinase inhibitors, or there's a lot of targets available and they're doing phenomenally better. And with the COVID again, there's so many new drugs been approved to treat that. And even treating chronic lymphatic leukemia is almost evolved to a different level now. So we don't hardly give anybody chemotherapy. And they're just treated purely by specially targeted treatments, including BTK inhibition or BCL2 inhibitors. So it is almost, the landscape has been changed completely. So it is a very, very good news and people are living long enough. So we're worried about second malignancy and long-term problems. So the immediate problems are all been much better, but they still need to be monitored closely. Some of the leukemia patient symptoms can be managed depending on what the main symptoms are. And majority of the symptoms will get better once you treat the primary disease. So we can't just manage like cough and cold. So you need to treat the bone marrow, clear the bad stuff, and then the new stuff will come up healthy. And that is what most of the treatments are aimed at. The things we need to supplement is giving pain relief if they need treatment for bone pain, and if there is infection control, prophylactic, antifungal, antiviral, antibacterial cover, which is very important. And during the COVID period also, this vaccinations is extremely important, and these are the group of people who are very vulnerable, and they need to be having extra vaccination booster doses and also specific antiviral treatment. So this is what important, that their immune system is not good. So during that phase, you need to be supported, and that's what they need. So again, as I mentioned earlier, the leukemia, if it is a chronic leukemia, it's much more easier. It's almost like diabetes or some sort of chronic illness. They need to take tablets for a long period of time. So it is not like the previous way of finite amount of treatment, but there are a lot of treatments. You just take a tablet every single day. And that keeps your chronic leukemias under very good control and getting into very deep remissions. Whereas in acute leukemia, it's still treated by chemotherapy, which is combination chemotherapy to what you call like induction, and then you get consolidation chemotherapy, and then majority of them, if they are young, fit, below the age of 70, they may need a bone marrow transplant depending on their genetic factors. So a lot of risk categorization happens, and depending on that, they would be referred for specialist transplant centers if needed. Otherwise, it's purely by chemotherapy, which they need 3 to 4 cycles. And some of the acute lymphoblastic leukemias, the maintenance treatment can go on for more than 2 years. So it's a long drawn treatment, but end of the day, after the initial induction, there's much more easier to manage, and it works better to control the symptoms, and that's the main aim, and keep safe from infections.